Managing diabetes is a complex task that involves various components, such as monitoring blood sugar levels, engaging in physical activity, maintaining healthy eating habits, and taking medications as prescribed by a healthcare provider. It is crucial to seek guidance from a healthcare professional before making any significant changes to your diet or lifestyle in order to effectively manage diabetes. Individuals with the O and B blood type are believed to be more susceptible to heart diseases, diabetes, and liver problems. For those with this blood type, a high-protein diet that includes lean meat, fish, and certain vegetables is recommended, while grains, legumes, and dairy products should be limited. Conversely, individuals with A blood types are advised to follow a predominantly vegetarian diet with limited animal products, as they are more prone to cancer. However, adhering to these dietary recommendations may prove challenging for some individuals due to food availability and cultural preferences. Ultimately, following a blood type-specific diet may help some individuals feel more energetic and aid in preventing or managing these conditions, but it is essential to do so under the supervision of a healthcare professional.